Welcome to Health Talk. Today's topic is what to expect when you visit the hospital, when you're a patient in the hospital. We have a very exciting guest for you today, so please stay tuned. Hello, I'm Dr. Andrea Peterson. Today's Health Talk is about what to expect when you're a patient in the hospital. Joining us today is Dr. Eric Mazer. He's my co-host and colleague on Health Talk, as you know. Eric is trained in internal medicine. He's an oncologist, hematologist, and has lots of years of experience in treating patients. So Eric, welcome to that side of the show.
It's a pleasure, because this feels very strange, Andrea, sitting on this side of the studio. But this is such an important topic. I think hospital is such an intimidating place, and people get afraid, confused, and I think there are lots of things that people need to understand about modern hospitals, because they certainly have changed.
Absolutely, and that's just what I was going to say. The hospital and how the hospital functions today is much different than the hospital as it functioned 25 years ago, isn't it?
Right, to start with, in the old days, you had a doctor who was your personal doctor. That doctor met you in the emergency room, and if you had a problem or saw you at his or her office, it was usually his in those days. When you got admitted to the hospital, that doctor came in, saw you every day, actually leisurely was able to round on his patients during the morning, and it was a very, I think, soothing experience. It's changed a lot now. The doctors generally stay in their office. Your doctor generally doesn't have the time, because they're seeing so many outpatients, to come to the emergency room to see you. So there's an emergency room specialist there who takes care of you. If you're admitted to the hospital, there's often a hospitalist, and that's how we met. Maybe you could say a few words about that. But a hospitalist is a person who specializes in taking care of inpatients. I think people find that initially a little bit off-putting and a little bit frightening, because the new hospitalist or the emergency room doctor may not know them as well. I think on the other hand, there is so much more that we can do today. There's so much more knowledge in medicine that I think it's better to have a specialist in outpatient medicine and a specialist in hospital medicine, because it's become so much more complex, and you could speak to that as a hospitalist.
That's right, and I think, as you mentioned, there were time pressures that pushed along those changes in medicine, but the other thing is treatments, diagnostics, options have really expanded tremendously in the last 25 years, and so for any one physician to stay on top of that all is a huge and daunting task.
It really is. I like to talk about this only because it brings home to me in my own career. CAT scans were not there when I started. MRIs did not exist. Chemotherapy did not exist. There were 2 or 3 antibiotics. There were no statins. There was one or two blood pressure medicines. It has changed. There were hundreds and hundreds of medicines now. The diagnostics have changed. It's overwhelmingly different.
And because of some of the pressures in medicine as well, the amount of time people can stay in the hospital, what can be done safely in the outpatient setting, we now know. It doesn't require being in the hospital. Those have all changed as well. So in the past, for instance, people undergoing routine colonoscopies, I understand, would often come to the hospital, have
I'll meet you and raise you a barium enemas before colonoscopies. People would be brought in, and we would clean them out in the hospital and give them some IV fluids. I guess people don't understand that medicine has also become highly regulated by the government.
That's right.
And what the Medicare and the insurance companies have said to doctors in the hospitals is, if you could possibly do this as an outpatient, that's all we're going to cover. We're not going to cover that patient. So we're under pressure not to be able to bring people in just for a rest or just for a tune-up, if you will.
Right. In many cases, That's actually a good thing. People, it turns out, don't need to be in the hospital for a week for a colonoscopy because it can be done very safely in other settings, and it's often much better to be at home. But when you do need to be in the hospital, you want to really make sure that you understand how the hospital works and how to get the very best care. So maybe we can talk a little bit more about hospitalists. So hospitalists are fully fledged trained doctors. The hospitalists at Western Connecticut are credentialed and board certified physicians. They're not under the aegis of your regular doctor. They're independent practitioners who are
Right.
practicing medicine in the hospital, specializing in that.
And I think the point, it's a separate specialty today. It's not a lesser specialty. I think people confuse hospitalists with interns or residents, and that's not the case at all. Hospitalists are fully trained. There are even certifications now for hospitalists, and they specialize in diseases you see in the hospital.
And one of the benefits of having a hospitalist take care of you in the hospital is that that's their job for the whole day. So they are there to help take care of you, to answer questions, to talk to your family, to follow up in pretty close to real time on test results or a CAT scan, whereas your primary care doctor who's in the office, even in the old days, would come often round in the morning, go back to the office, maybe round in the evening. So it took a longer period of time for decisions to be made.
Absolutely.
Now, if you have a CAT scan or an MRI done in the morning, often your hospitalist can be there to talk with you about it in the afternoon and figure out, okay, what's the next step here?
So maybe you could say a few words. How does the hospitalist know enough about the patient to take care of them? Because I think this is what people worry about is, oh, well, Dr. So-and-so knows me so well, how can you possibly take care of me as a hospitalist?
That's a great question. I think there are so many facets to that. So first and foremost, we want hospitalists to be really communicating with your primary care physician and your important specialists, the ones that have something to do with why you're in the hospital at that particular time. One of the things many patients don't understand, actually across the nation, people think, well, you have my records on a computer, so you must be able to see everything that's ever happened to me, whether it was in California or Alaska or Connecticut, and that turns out not to be true. Unfortunately, electronic medical records are not always connected together.
Yeah, and maybe you could say are usually not connected together. This is a sadness, I think we can blame our government for not setting standards, but the reality today is the office system that Dr. Jones may have often will not talk to the hospital record system that you have, even if it's right across town, certainly across the nation. Even if it's the same name system, they have separate databases to protect medical confidentiality. So unfortunately, I think each time somebody goes to a new venue, the physician, the provider has to rebuild that story to some extent.
And there are many places, and in our communities included, who are working very hard on this issue. And it takes a lot more actually to integrate those medical records than I thought at first blush. But it's worth knowing when you come into the hospital, can the doctor see your outpatient medical records? But even if not, the hospitalist is calling your primary care physician, getting information. Often we can electronically get information from pharmacies to know about medication lists, but none of this serves as a complete substitute for you, the patient, coming in with information.
And we've talked in the past about how do people can optimize their office visits. I think some of the same things can help optimize their use of the hospital. Keep a list of your medicines.
Absolutely.
Always. What you're taking. Keep a list of everything else, over-the-counter medicines, any supplements you're taking. Have that with you at the hospital.
That's right. Have it on a card, have it on your phone, keep it up to date. Have it in a way so that if there's an emergency and you go to the emergency room, you still have that list of medications. Have a list of anything you're allergic to or have a bad reaction to. So there are true allergies, but there are also things that are not allergies but are significant bad reactions.
And some patients I've seen collect copies, hard copies of their lab reports and their x-ray reports.
Absolutely.
That can be enormously helpful.
Absolutely.
And you never should be embarrassed to ask for those copies because they're yours.
They belong to you. And especially if you have complicated illnesses, if you're seeing multiple physicians, sometimes having those reports or having things in black and white, people can keep them in a binder or a folder. That can be tremendously helpful.
So although we're at the information age right now, it's really, and so much now is on computer for each patient, we have problems with these computers talking to each other.
Sometimes
and we're
we
not
still
there
do.
yet.
So
and
we're working on it and we're
Yep.
making progress, but having that information for yourself can often be very important.
Now, the other thing that happens in the hospital, they get seen by a dizzying array of specialists. You'll see different hospitalists. How do you keep, first of all, who's in charge? Let's talk about that. Because there is somebody in charge, although the
Absolutely.
patient doesn't realize that sometimes.
There's always somebody in charge, and different hospitals will work somewhat differently, but the person in charge is the attending physician. And
How do you find that out?
any nurse should be able to tell you. When you talk to any physician who comes in to tell you, they should be able to tell you who is the attending
So
of
if you're
record.
in for surgery, it will likely be the surgeon
That's
who
right.
admitted you. If you're in the most hospitals, it'll be the hospitalist.
That's right.
Although the hospitalist may change, and you may want to say something about that, too.
That's right. So hospitalists work as a team because, like anybody, one particular hospitalist can't work 24 hours, 7 days a week for 365 days a year. So hospitalists work as a group, and you may see different hospitalists along the way in your care, but the communication should be excellent from hospitalist to hospitalist.
And actually, one thing a patient can do if they are admitted to a hospital with a hospitalist is to ask them what kind of schedule they run. Because
Absolutely.
it's different from hospital to hospital. You may have a hospitalist who's there from 8 to 6, 7 days in a row. You may have people switching every 8 hours. And I think it will help you to know that that's happening, and you can get a list of the names.
Yep.
So you can always know who's in charge.
So feel free to write down names of whoever comes in to see you, or have the doctor write down their name and where they are in your care team. So as you mentioned, you may have a hospitalist who's the attending internal medicine doctor, for instance. If you're in with pneumonia, you may see specialists. You may see a pulmonologist, say. That pulmonologist may be your pulmonologist if you have one, or could be your pulmonologist's partner. You will also, in some hospitals...
But we should point out, those people come in at the request of the hospitalist.
That's right.
They, again, sort of the rules are that specialists come in only as asked by the person in charge, so there's some coordination.
Absolutely. And you mentioned also, you may see people who are in various stages of medical training. So teaching hospitals provide outstanding care in the United States.
That's
and they're
actually
very
been proven,
important.
that the
it's
results
actually been
that-
studied and proven.
But yeah, let's say, because I think a lot of people who are not familiar with teaching hospitals are a little uncomfortable being the guinea pig or feeling that people are learning on them.
And we have a little under a minute left, so just to mention that that's really not the case. Teaching hospitals provide excellent care. You've been around teaching hospitals for quite a long time.
My whole career. and the point is that people are given authority in a graded way that allows them to think independently, and yet there's always supervision. There's always a net
Absolutely.
of supervision. So nobody's going to make a decision that doesn't get reviewed by a more senior physician who is able to correct that if it's not exactly what's right for the patient.
And I've always practiced in teaching hospitals, and the way I think of it is you have a whole team of really smart people thinking about you.
And I will tell, I don't know if there's enough time, there was a brief story about a patient that didn't wake up after anesthesia, and everybody was very confused, and it was the medical student that thought of the diagnosis of porphyria as a possible. None of it's a rare thing, and the medical student set off the test that was the right answer to that particular patient. So having a group of often can help, not hurt, because you've got a team thinking about you.
And it's a great way to end our show. Eric, it's been a pleasure to interview
It's fun to
you,
talk about
with
these
you
things
about
because they're so
these
close to our
things.
heart.
And thank you so much for joining us on this week's Health Talk. Please do send us your questions and comments to healthtalk@wchn.org. Eric and I would love to hear from you.